This is a CBS 4 News special report.
Miami-Dade Mayor Carlos Gimenez giving the latest on the coronavirus pandemic. Let's listen into his virtual press conference.
To their door should contact their case managers. Let me stress that the staff at senior centers can continue to provide meals, medication, services, and bathing all at home for seniors. This gives seniors the services that they need so they can stay safer at home. If you're a senior and need meals or other services, you can call 311 for help. To date, we've delivered more than 300,000 meals to seniors countywide. Now, in the new guidelines set by the CDC about the use of cloth masks for employees and customers at essential businesses such as grocery stores and pharmacies, I've already urged that anyone who wants to use a cloth mask or other covering for your mouth and nose can do so. But I want to avoid giving you a false sense of security. With or without the mask, you must practice social distancing. Even people who feel perfectly healthy and are wearing cloth face masks can be transmitting COVID-19. So everyone, keep your distance and do all you can to stay safer at home. I also want to remind you that we are limiting capacity to 50% at places that provide takeout food. I also ordered closed all salad bars and other open food areas. Businesses should focus on prepackaged, sealed foods to reduce COVID-19 spread. Today, the Coral Princess cruise ship is disembarking passengers who are heading to MIA to get home. I want to offer my condolences to the families of loved ones of the two people who died from COVID-19 on that ship. It's heartbreaking news. You know, there are two passengers on the ship who need immediate medical attention here in Miami-Dade. There are more that will be transported to other hospitals in Florida, and these two are being taken to Larkin Hospital. All other passengers are being screened before heading to the airport to get to their final destination. We will have many more harrowing challenges in the weeks ahead, so we're doing all in our power to fight COVID-19 on every front. Now I'll be available for any questions that you may have in English.
Okay, first up with a question will be Hatzel Vela from Local 10. Hatzel.
Mayor, I wanted to ask you about good morning, sir. First of all, I wanted to ask you about this Coral Princess situation, because as we saw in Broward, there was a lot of back and forth in trying to make sure that they met stringent plans to disembark these folks. How did it happen on the Miami-Dade side? A lot of folks are saying this kind of surprised everyone, how quickly it happened. When did you find out that this was a situation that you needed to deal with? And then when did you decide, okay, we're letting them in because they have the right plan?
We started working on this sometime in the late morning, afternoon yesterday. Before they were allowed to come in, they had to have a plan. And so, but listen, I'm a firefighter, and to me, it's the best, you know, we have to save lives, and there are people dying on that ship. And so it's unfortunate that on the way here, two passengers died. And so for me, it was, okay, we got to take some people off that are in serious condition. We need to save some lives. They need to have a plan. The plan didn't really come into fruition until, you know, early morning hours of this morning. But I'm convinced that the plan is solid. I spoke to the admiral in charge of the Southern District of the United States. He was very much involved in it, and he guaranteed me that there's a solid plan in place. Most of the passengers on that ship are not ill. The plan calls for us to bus them directly to MIA. Most of them are going to get on a charter, won't even go into the terminal. The other ones we put into the terminal, a closed terminal, and then when they're ready to board their commercial flights, we basically put them right on board. And they're all to wear masks all the way through to their final destination. And so that satisfied me. There are a number of passengers and crew that are going to have to remain on board because they're still ill. The crew members, there are about 40 of them. They're all relatively young. Nobody is actually needing any kind of hospitalization. There's about, I think, 15, 16 passengers that are not fit for travel in the sense that they haven't been cleared. They won't be cleared by the CDC. They're going to have to remain on board. That particular ship actually has pretty good medical capabilities. And so, we hope that they recover on the ship and then, can find their way to the final destination.
Thank you, sir. Phil Prazen from NBC6.
You need to unmute. Thanks.
Can you hear me okay?
Yes.
Two questions really. One is there anything from your end that could speed up the charter flight process? I know a lot of people are just kind of waiting on the crews until the flights are available. And then two, to your knowledge, are there any other cruise ships that will be coming in?
At this point, no, we have no other plans for any other cruise ships to come in. But one of the things that we do put pressure on the cruise ships when they do come here is to charter flights to get either their passengers or a lot of their crew off the ships and get them to their home destinations as quickly as possible. So we are actually disembarking every day here, somewhere between 250 and 500 crew members from the cruise ships that are already there. And they're normally going on charters unless there's a commercial flight that can take them back to their home. And so that operation is happening every day here in Miami-Dade.
Let's move on now to Doug Hanks with the Herald. Doug, are you on the line?
I am. Thank you so much. Mayor, can you go over again the numbers of passengers that are on the ship, that have to stay on the ship, and how many are leaving today?
Yeah, there's 1,020 passengers that are on the ship. 993 as of last night were deemed fit to travel. That means there are 27 that are somehow not yet fit, deemed to travel. There are 878 crew, which 840 are fit to travel, and there are 38 with symptoms. And so those with symptoms will not be allowed off the ship. The ship actually is pretty well equipped medically. They have at least 4 respirators that I know of, and they have, I believe, 4 doctors and a number of nurses on there. So the plan right now is for them to remain on the ship until they get better. Those that, and then we'll have to deal with any situation if the ones get, that are beyond the capabilities of the ship. We'll deal with that as the situation arises.
Thank you, sir. Mark Freeman with the Sun Sentinel.
Yeah, sorry. No, I think those questions were answered. How was it that this ship managed to go from Port Everglades to Port Miami? Do you have any of the backstory on how that took place over the past day or so?
I was asked by my port director. We had a situation where the ship was asking to dock in Port Miami. I asked about the situation in Port Everglades, but at the end of the day, we had some people that were dying on that ship, and we need to get them here as fast as possible. And so, at the end of the day, we're going to save the lives, and then we're going to worry about everything else afterwards. We have capacity here in Miami-Dade. Obviously, if the situation changes in Miami-Dade, then we will have to, make different decisions, because the number one priority for me are the people and the residents of Miami-Dade. But in this case, these people were dying. Obviously, 2 of them died on the way here. So we need to get that ship in so we could save those people. And I looked at it in this way: that were one of my relatives. What would I want that the mayor and the port director to do? Probably to bring my loved one home as fast as possible and give them the best medical care as quickly as possible.
Thank you, Mayor. Patricia Mazzei with the New York Times.
Hey, Mayor. Thank you. I wonder if you've had time to take stock in all of this that's happening, and if, with the benefit of hindsight, you have started to think of things you wish you or other cities or counties or the state had done earlier in this process, shut down earlier, cut off spring break earlier, shut the hotels earlier, anything like that?
It's always 2020 is perfect hindsight. And so I don't really deal in 2020. Could have, would have, should have. We did what we thought, and I'm sure all cities did what they thought was the right thing to do at the right time. This is it's called novel coronavirus for a reason. They don't really know how it acts. Remember, at the time, we didn't even have any cases here for very late into this event. We have more positive cases here, probably because we are doing much more testing than anywhere else. I think we've done about 20,000 tests here in Miami-Dade County alone. The state of California, from what I understand, has done about 35,000 in total. So you're going to see a bunch more positives here because we've actually tested more. At the end of the day, what I really I'm focusing in on is how many hospitalizations do we had, how many ICU beds do we have, how many ventilators do we have, and are we ready for some kind of a surge? We have well over, at last count, I think we had something like well over 4,000 empty beds, hospital beds. We had well over close to 300 ICU beds and another 400 beds that can be converted to ICU very quickly. And we had well over 700 ventilators that are available here in Miami-Dade, with a lot more on the way. And the state government is telling us that they have hundreds more that will be here shortly. And so we have the capacity, and then we just have to, that's what we really need to take a look at. The number of positives is a byproduct of the number of tests that we have been giving. And we've been given so many more tests that obviously we're going to have the most positives here. And also we are the largest county in the state of Florida.
Thank you, sir. Glenna Milberg with Local 10. I know she's on here. I think I see her. Glenna, are you there? Okay. I guess she is not connected. Anyone else with a question in English for the mayor before we move on to Spanish?
I have one. This is Hannah from the Washington Post.
Hi, Hannah.
Hey. Mayor, you mentioned that 2 people were going to Larkin, and that other people were going elsewhere. Do you have the number of people who will be transported on the ground to facilities in South Florida? And also, do you have an updated number of how many people on the ship had been confirmed positive for COVID?
No, I can't tell you how many are confirmed positive. I don't have that. I do understand that there are some people that have symptoms. So maybe COVID, it could be something else. So there are 2 people that are going to be transferred to Larkin. One is an American, one's Australian. And there are 2 Americans that are going to be transferred to a hospital in Tampa. We had originally 6, but apparently two passed away on the way in. So that's the numbers that we have right now. We have 20-something folks that are going to stay on because they've got some kind of symptoms. It could be COVID-19, maybe it's something else. And we have about close to 40 crew members that are feeling some kind of symptoms also. They're not sick enough to be in any or require any hospitalization. The folks that are staying, the passengers that are staying, they're not fit for travel. They'll be taken care of by the medical personnel and equipment of that ship, and it all depends on what their outcomes are. We expect most of them to get better and then travel on. Some could get worse and then may need further medical help.
Thank you, sir. Glenna, I see you there now. Would you like to ask the mayor a question?
Yeah, apologies. I don't know. I'm not very good at muting and unmuting, but anyway, hi and thank you. And Mayor, the last county commission meeting last month, which seems like a lifetime and a half ago, you had mentioned in the course of talking about Port Miami that there would be a quarantine area right there at the port for what sounds like exactly what happened with the Coral Princess this morning, to offload, and anyone who might be infected, there would be a special isolated place. Is that still a plan, and what is that status?
I expect that to be the plan. We kind of and asked the port director to have one area where all of these ships, if they were disembarking, to go to so that we can quarantine them. It's an area where Customs and Border Patrol can go ahead and clear the passengers. Then they get right onto a bus. They get back on the ship, but they don't have a flight that's scheduled in the next 2 or 3 hours. They would get right on a bus, taken to MIA. A lot of them go to a Signature Air, which is a FBO on the north side of the airport. They get on they board their charter, and then they're taken home. Some go on commercial flights. We segregate those folks into an area of the terminal that's not being used. And as their flight is ready to board, they'll board. All of them will be given masks, even though they are fit to travel. On the way to the airport, at the airport, and they're instructed to keep the mask on until their final destination. And then they're instructed to self-isolate at their final destination for 14 days.
Martin Vasolo with the Herald.
Hey there. Thank you for organizing this presser. I wanted to zoom back into the local news here. What are the hours for the South Dade testing center, and when will it open? Is it Sunday or Monday?
It opens tomorrow. I'm sorry, I don't have at my fingertips the hours. We know that you can call the number that I gave out on my presentation. You can call that number. That will do the scheduling for both the Marlin site and South Dade. And we're working really hard to open up a site at the Youth Fair, and hopefully we can open sometime in the early part of next week. So that'll give us a number of testing sites here in Miami-Dade County for folks 18 and over that have symptoms. So I can't really tell you what it is. We know we fill I think 300 slots for South Dade, and then as long as it takes to get it done, that's how long we'll be open.
Thank you, sir. We have Jessica Vallejo with CBS 4. Jessica.
Hi, thank you. We spoke to passengers earlier today, and they're very happy to get off this ship, but they're also kind of concerned. Can you ensure that the plan that we have in place is safe?
The plan is as safe as the Port of Miami and the U.S. Coast Guard and the Miami International Airport make it. I have been confident of the abilities of my port director, my airport director, my port director, and the U.S. Coast Guard to safeguard the lives of American citizens here in Miami, and also do the best they can to safeguard the lives of those passengers. You know, they're human beings. They need to be able to get to their destination as quickly as possible, but in a safe way, also without potentially infecting anybody else that may be on that flight. Some of these charter flights are 100% these passengers. Some of them, I think the minority of them will actually get on some kind of commercial flight and then head back home to their destinations.
Thank you, sir. Anyone else with a question in English before we move on to Spanish?
I do. Hi, this is Mel Alonso from CNN. Thank you, Mayor. I have a question about the U.S. Coast Guard said today that there were about 114 cruise ships near or in ports and waters in the U.S. Obviously, there's a voluntary suspension of cruise ships operations, and that doesn't happen overnight with such a large industry. But do you foresee a complete stop of these ships coming in anytime soon, given the current situation?
I think eventually that we're going to say, look, we have taken so many, and this is our capacity. They may need to go some other places in the United States where we don't have as many positive cases or use of our hospital resources. And so what we've been trying to do with the cruise ships is a lot of them are out there with their crew and trying to tell the cruise industries they need to start getting those healthy crew members off the ships and just keep a very, very skeleton crew to operate the ship, so that if anything does happen on any particular ship, the exposure to people is a heck of a lot less. That's why we're transferring crew members off the ships right now, and that operation is happening every day. And like I said, we probably get 250 to 500 crew members off every day, take them to MIA. They're in a separate terminal, put them on airplanes, and then they can head on back to their destination. A lot of these crew members are from the Philippines. A lot of them are from countries in Europe. And so that's what we're trying to do. That's what we're doing every day to thin out the numbers of those crew members that are still on board.
Thank you, sir. Okay, last call for English questions. Okay, we'll move on to the mayor's remarks in Spanish. Mayor.
Thank you.
That was Miami-Dade Mayor Carlos Gimenez speaking regarding the coronavirus. He touched on a number of topics, including a new testing site at the South Dade Government Center that is set to open tomorrow. He also discussed the cruise lines, the Coral Princess. He says they have a solid plan for that ship docking at Port Miami. He explained that the healthy passengers will be bused directly to MIA, where they will go to a separate closed terminal. But those who are showing symptoms, which he said is about 27 people, will have to stay on the ship with medical care until they are recovered. On that ship, we do know that 2 people have died. At this point, it is unclear if their deaths are from COVID-19. But we have much more tonight on CBS 4 News at 6, as well as CBSMiami.com. Stay with us.